All right, so welcome everybody. My name is LeRoy Horton. I am your presenter today. And one thing that I've done for the last 10 to 12 years is I've really tried to sell dentistry as a viable profession for all of y'all. Um, Most students your age are, when you think healthcare, are automatically drawn to medicine. Why? Because there's shows like ER and Grey's Anatomy and House, and there's this romanticism around medicine, and that we don't even have one show for dentistry. So my job is to make dentistry attractive for you by showing you some of the cool things that we can do. Um, and a lot of times, some of the stuff I'm going to be showing is a little graphic, so this is a warning for everybody. If you uh, don't have the stomach for seeing graphic images, no worries, just look away or turn your screen off and you can just listen to me. Um, but I did have to give you that warning. So I'm going to try and condense the presentation into about 35 minutes and allow 10 minutes for Q&A. So please drop some questions in the chat if you have them, and I'll try my best to answer them towards the end. So before I get into telling you about the professional me, let me tell you about the personal me, because let me start the presentation here. What I don't want you to leave with is the notion that there's anything inherently special about me or any of my colleagues that do this. We're just like you. We were just like you when we were your age. Only thing that we did different than other people that wanted to follow this path was we had the discipline to stick through a rigorous path and program, but that's the only thing. We're not necessarily inherently, smarter, brighter, no photographic memories. People perform in academics in different levels, and some of us had to really grind it out. Other people retain information more easily, but at the end of the day, it's about ascribing yourself or committing yourself to a goal and just having the discipline to stick with it. So to tell you about me, I am a first generation immigrant. I was originally born and raised in Athens, Greece. This little chunky, cute baby is me. Yeah, my mom, my grandparents, one of my uncles, one of my aunts, and some cousins. We immigrated here when I was a teenager. Just me, my mom, and my brother. And my mom is one of the biggest inspirations where I draw a lot of strength from, because she came to a foreign country not really knowing the language, worked 3, 4 jobs to build a foundation for her sons to be able to build a better life for themselves. Fast forward, I'm here talking to you. I have a beautiful family with 3 amazing kids. So far, they've all been very good. I was a little bit of a rebel rouser as a teenager, and luckily, karma didn't hit me back by giving me rebel rouser kids. So all 3 have, for the most part, been pretty chill, which I am very thankful for. A little bit about myself. I am an avid adrenaline junkie and thrill seeker, and I do a lot of active things. I do a lot of half marathons, do a lot of adventure races. So I do Spartan races every single year, warrior dashes, mud runs, and so forth. I was an amateur fighter for around 10 years or so. I still train, but I don't compete in my older age of 40. But it's something that I truly have a passion for. And I have been in rings and cages uh, all over the state. And if you ever want to really test your capacity for handling adrenaline, climb into a cage with someone else that's trained to take your head off, and you kind of find out what you're made of in life here. But that's the personal me. I want to introduce you to the professional me. So Again, my name is LeRoy Horton. I am a DDS, or Doctor of Dental Surgery, and the other letters that you see, DICOI, stand for Diplomate of the International Congress of Oral Implantology, which means I'm board certified and specialize in implant reconstructions in the mouth, and you'll learn about that here in this presentation. If you haven't heard of that before. But my path to get there, after high school, I went to college. I went to Pacific Lutheran University and got a degree in biology. Afterwards, I got into the University of Washington dental school and spent another 4 years there. After that, there's a lot of training and education that happens after you graduate. So afterwards, I was trained in sedating patients through the Oregon Academy of General Dentistry. I got what's called a fellowship through the New York University College of Dentistry. I got my board certification, so it was a rigorous process of learning, demonstrating competency, case presentation, case defense in front of a panel, a grueling board certification exam that certifies you as someone that has dedicated a large portion of their career and life to the area of what's called oral implantology. I am a national continuing education instructor, so I teach a lot of the procedures that I do to other doctors. And I started my own dental educational company called Teach Me Implants. And that's usually where I do a lot of my marketing for my continuing education courses that other doctors come to for learning advanced procedures. I'm a part-time instructor at the Department of Oral Medicine at the University of Washington School of Dentistry. And I will be doing a surgical residency starting in June with the Oregon Health Sciences University. It's a 3-year surgical residency. Okay, so the general journey is going to be very reminiscent of what you've seen with medicine. And I always kind of use medicine as the template for which to compare to, because a lot of you are a lot more familiar with medicine than you are dentistry. So just like medicine, there's 4 years of college. There's 4 years of dental school, just like there's 4 years of medical school. Where we differ is that your residencies after your 4 years are optional. You can come out and practice as a general dentist, or you can go into any myriad of specialty residency programs afterwards that can range from anywhere from 2 to 6 years. Some of the residencies, you pay tuition for that residency. Other residencies actually pay you a stipend. It's not a lot of money, but it's enough to, maybe pay for rent and some meager food during your time as a resident. So that's not too different from medicine, because when you're a medical resident, it's pretty similar to that. Continuing education in any profession, whether it is medical dentistry, whether it's nursing, whether it's engineering, whether it's construction, you always have to follow through with continuing your learning, because technologies change, the science changes. There's always new data that comes up on things that we've been doing for years that let us know we either need to change our protocols, revise our protocols, or stop doing what we were doing and do something new. So anytime you commit yourself to a profession, it's going to be a lifelong commitment of continuing education. And there's a myriad of programs. Like I said, I teach continuing education programs, so dentists will come to me. Some of mine are webinars. So it might be a 2 or 3 hour webinar that I put on, or some of them are live surgery in-person courses. So they'll come in for lecture, and then they get to either observe or do a hands-on surgery themselves. Now, what classes do you have to take in undergrad? Again, so much like medicine. 8 hours of biology with a lab, 8 hours of physics, 8 hours of English, 8 hours of general chemistry with a lab, 8 hours of organic chemistry with the lab. And then there's a mix and match of other courses that you're going to take to fulfill your 4-year degree requirement. But these are the main requirements when you apply to a dental school that they're going to see and want you to have taken at minimum. Once you get into dental school, you'll have gross anatomy of the head, neck, and trunk, neuroanatomy, microscopic anatomy, My very first day of school was in gross anatomy. And we actually did gross anatomy with the med students at the University of Washington at the time. And you think first day, there's going to give you a syllabus. They're going to tell you what we're going to do, introduce ourselves as the professors, and then, all right, we'll start real class tomorrow. After the introductions, they sent us up to the 7th floor. You walk into the cadaver room where there's 50 cadavers, or people that have, nobly donated their bodies to medicine and science, and we started dissecting on day one. So that was a rude awakening to, you're not in Kansas anymore, you're not on the playground, you're in training to be a doctor, and you're starting on day one. And that was, a very eye-opening experience, especially if you don't have the background in, not only in graduate training, but specifically working with cadavers and dissecting. We get a lot of training in general and oral pathology. A lot of systemic diseases present themselves in the mouth. And so we are kind of that first line, especially when it comes to oral cancer, of screening and finding lesions or sores or tissue that just doesn't look right, being able to biopsy it and send it in to a pathologist to let us know if it's something is it benign and something we don't have to worry about? Is it just an inflammatory process, or is it some type of carcinoma that needs further treatment? But dentists are absolutely on the front line of recognizing oral cancer in the population. Unfortunately, oral cancer usually has no symptoms, no pain, no discomfort until late stages. That's why it's very important for us to, every time you come in for a checkup, we look at all your soft tissues, your cheeks, your tongue, your lips, the back of your throat, just to make sure all the tissues look normal and healthy. We get trained in medical emergencies, in sedation and pain control, and obviously anyone that's been to a dentist and had a filling or something done and you had to get numb, we get trained in local anesthesia, so a lot of numbing. We also get trained in clinical theory, in geriatrics, in special needs patients, and dental fears. Dental anxiety, or fear of the dentist, is one of the top 3 fears in the world, and so we deal with a ton of anxiety. We try to manage it with obviously good chairside manner and a soothing voice, but when that's not enough, we have a lot of drugs and procedures like the sedation that I do, where someone comes in and if I'm taking out their wisdom teeth, we'll put an IV in their arm. The next thing they know, they're waking up and their wisdom teeth are out. It was a very comfortable experience, and it doesn't build any traumatic emotions at the mere thought of the dentist, if we had done that without being able to somehow control that anxiety with medicine. So I'm going to skip some slides here in the interest of time, so I want to get to the case presentation. Now, in dental school, did I learn everything I need to know? Absolutely not. You're going to figure out whatever vocation or job or career you're looking for, whatever your training program taught you, they train you to be the minimally competent version of yourself. Life experience and continued learning will take you from competent to good to great, but no one graduates great. You graduate competent. And so that's something that you really realize early on, is that, yeah, you kind of know what you're doing, but there's no true better teacher than experience. And every patient is going to be different. It's going to present you with different looks at similar things, and your learning escalates from there. So 80%, if not more, of what you learn, you're going to learn after graduating. The dental profession in general is geared towards private practice or corporate practice. And one thing that regrettably my school didn't give us a lot of was business education. So there's a lot of school of hard knocks in running your own business when you get out as a dentist. They really don't teach you much on advertising and marketing, especially in the digital age. So often you're at the behest of all the Instagram gurus and Facebook ad gurus that promise you they can get you X amount of likes and ads and all that kind of stuff. But it's good as time goes on to learn the ins and outs of those aspects of business yourself so that you're not taken advantage of. And you have to deal with insurances. Insurance is an entire industry who their profit is based off of not paying you for what you did for the patient. And so I have an entire team dedicated to make sure that what we did gets paid for by industry that doesn't want to pay for it. But that's a whole nother lecture in itself. And as a business owner myself, one of the hardest things I've ever had to do is manage people. So I have 2 offices, about 10 staffers in each one. And there's days where I just want to pull my hair out, not because I had a hard surgical case, but because trying to manage 10 individual humans that might have conflicted with each other, that all have their own needs, you have to have the right temperament for that. And most days I do, and some days I definitely don't. All right, so before we get to the case presentation, and I think I'm doing good on time, what makes a good doctor? There's 4 pillars as I was thinking about in creating this content. One, you have to have some level of intelligence, right? You have to be able to develop good study habits, to learn to demonstrate what you know, and a lot of that is in the form of test taking. There's, when dealing with classes of hundreds of people, the school doesn't have time to individually test everybody in their particular way of testing, and so there's a lot of obviously standardized testing. Some people are good at standardized testing, some are not. The good thing about standardized testing is that it's standard, okay? They've been doing it for years. There's systems and schools that teach you how to take the tests. There's old material out there so you can take practice tests, but it's your responsibility at some level to demonstrate what you know. So you have to be able to retain the information that you're taking in and then regurgitate it in whatever format that comes. You have to have compassion, all right? You're working on human beings, on other living entities. You have to be able to connect with people. I'm a firm believer that you can't do your best job with someone unless you care about them. All right. Now, that doesn't mean you have to know every little detail of their life, but you have to realize that what you do is going to affect another human being. It's going to affect their loved ones, their spouses, their kids. So you have to care enough to want to be great and provide a good service to your patients. You have to have integrity in what you do. Okay. You have to have a desire to continuously provide consistent quality. Okay. That doesn't mean every time you do something, it's going to be the best thing ever done in your life. Okay. It's not going to be your best procedure every single time. We all have failures. We all have things that didn't quite come out the way we wanted them to, especially because you're dealing with the human body, and the human body isn't always predictable. But you have to have a true desire to provide consistent quality for your patients. And you have to have a determination to be great. Okay. Doesn't mean you have to be the best, but I'm a big proponent and you have to be your best. Okay. In anything that you do, you want to be your best at it, especially if it's something that you're going to call a career. And you have to be able to demonstrate critical thinking. Okay. You've learned all this information. And a good example that I like to use or analogies, I was a math tutor in college, and I would get students that they would memorize the practice problems. So if I gave them a problem that looked just like the practice problem in the book, oh yeah, they knew that, step 1, step 2, step 3, this is what I do. But if you give them a similar problem, but you change the wording a little bit or change the sequence and how you give them the information, all of a sudden they're lost. Okay. You have to be able not only to retain information, but to be able to look at something that's complex and be able to apply all that information to this complex case. And that's very key, especially when you're diagnosing people who may have numerous conditions at the same time. You may have someone that has high blood pressure and diabetic, and they may be on medicine for What's a good example? They might have epilepsy. So now you got high blood pressure medication, anti-seizure medication. They might be taking a drug to control their blood sugar. They might be taking insulin, and they might be presenting with certain conditions in their mouth. And you have to take all that information. Well, how much of this is caused by the different drugs that they're taking? How much of this is caused by their systemic diseases? What can I do given this very complex case? And you have to be able to think critically. Now, none of these pillars is more important than another. We're all going to have different varying combinations of each ones given our own individuality and our strengths and weaknesses. But you have to always strive to maximize your abilities within each one of these categories. And of course, you have to be able to keep learning. This is an example of impressions that we take in my office now. It used to be you go to the dentist, and any of you that have been to an orthodontist, you take these gooey impressions, and it's material that gets squishy in your mouth and then hardens and they take it out. Now a lot of our impressions are digital. So that means not only do you have to learn how to use the hardware, but you have to learn how to manipulate the software. So you're always learning, and this software is always getting updated, and you have to, learn the new tools that they add to it or the glitches that they fixed. And you always have to have an ability to continue to improve your knowledge base, especially with the rate at which technology is changing. And this all comes together in you being able to treat a patient that is relying on you to do something potentially life-changing for them, that has, a certain amount of risk, a certain amount of danger, but you're ultimately responsible for all of that. Okay, so I'm going to talk to you in my case presentation about implantology. So in implantology, it's surgeries that we do in the mouth that allow us to reconstruct a patient's function and aesthetics. If someone is missing their teeth, we need to be able to replace those teeth, and we can do that nowadays by implanting titanium screws that I'll show you in a bit here into the jawbone. Sometimes it requires complex surgeries where if they don't have enough bone, we have to help them grow bone in certain areas. We might take bone from one part of the jaw and transplant it to another. We might have to do surgeries, as this is one of my surgeries in the sinus, where the sinus is an empty cavity, and we have ways we can actually fill bone into the sinus and trick the body into turning that bone that we've added into its own native bone. So by the time it heals, now we have where we had no bone, now we got a ton of bone. Why do we do this? Well, the National Institute of Dental and Craniofacial Research has shown study after study that missing teeth leads to poorer diets. A lot of the healthier foods, your vegetables, your meats, your legumes, your nuts, they all require teeth for chewing. And when you're missing teeth, you will be relegated to softer, mushier, usually high starch and more unhealthy foods. In 2006, a study by Hyde and others on welfare recipients showed that those who finished comprehensive dental treatment were twice as likely to get a new job and move off of welfare. So not only are we changing people's lives in giving them the ability to eat better foods, to be healthier, we're also changing their socioeconomic abilities. I do a lot of work with veterans of foreign wars that come back after very traumatic experiences, serving overseas. Sometimes with PTSD, they fall into heavy drug use. One of my friends' mother is a social worker with the VA, and when her vets that have gone through a certain process in their rehabilitation are ready to reintroduce themselves into the workforce, they come to me and rehab their mouth at no charge. Because if you're trying to go for a job interview, a lot of times society puts a heavy judgment on how you present yourself, and one of those presentations is your smile. So if you're missing teeth, if you have teeth that are broken or blackened or bombed out, you are initially and heavily judged on that. and less likely to get jobs. So we're able to improve someone's health, but also help improve their socioeconomic status by reconstructing their teeth. So this picture depicts a titanium screw that we insert into the jawbone. And what it does is it serves the same purpose as your natural root does. Okay, so we're essentially using titanium roots and putting them into the jawbone where the tooth has been lost or the tooth was missing. Then we're able to use these prosthetic attachments to attach crowns to those implants. If you're missing more than one tooth or you're missing all your teeth, we can actually put multiple implants in and create a fixed implant bridge that looks and acts just like natural teeth would. So now instead of relying on maybe a floppy denture that every time they bite into something, it moves, or when they're taught, you've all seen the funny videos where someone's talking and their denture flies out. A lot of times, if patients have been missing teeth for a long time, their bone tends to shrink, and the more your bone shrink, the less retentive it is to the denture. So the denture won't stay in as well when the bone is shrunk and sharp. So we're able to add these implants into the bone and help attach those dentures to those implants. So now they can eat the corn on the cob, they can eat apples, they can eat raw vegetables, they can talk without the fear of that denture flopping out. It makes them more confident, it makes them more social, as well as increasing their ability to eat more healthily. As part of that, we do procedures that affect the bone. So in order to put an implant in, I have to have enough bone on either side of the implant to help support it. If I were to try to put this implant here where the bone is very sharp and I didn't try to grow it or I didn't shave it down first, then that implant wouldn't have bone around it to support it. So in some instances, we'll do what's called a bone graft, where we take bone maybe from one part of the jaw and transplant it to the place where we need it. Or we'll take, as you'll see potentially in one of the surgeries that I'll show if I have time, we're able to take donated bone from people that are organ donors. We take the mineral from that bone that's been processed at a treatment plant, and we can actually add it to an area where a patient is missing bone. And your body has the amazing ability to, as it breaks down that foreign particles that you put in, it deposits its own bone as it goes behind. So I'm able to add an entire volume of bone where we previously had no bone, so then I can effectively put an implant in. So what I'm going to do is, let me fast forward in the interest of time. Typically this presentation, I usually give it when I have like an hour, hour and a half, and we got like 45 minutes. So I want to make sure you get a real good, interesting case here. There we go. So here's my patient who is missing all their lower teeth. You can see the gums are kind of pointy, right? And it comes out to a wide base. They've been missing their teeth so long, the bone is shrunk. Now, you can see behind me, I have this wonderful machine called a CAT scan machine. And I'm able to take a three-dimensional picture of someone's entire jaw, and I can create slices anywhere I want to and to make exact measurements and see the three-dimensional shape of that bone. So here is a slice of somewhere right here in the middle, and I take that image and open up that slice so I can measure the dimensions of bone in this direction here. And you can see that sharpness of bone that I was talking about. It was missing teeth for so long that it shrunk, and that's why this denture is flopping around. It doesn't like to stay in place. I want to put an implant in, but as you can see, here's a digital implant that I'm planning to see where I have enough bone or what I have to do to this bone. And a common procedure in this particular area in the front of the lower jaw is called bone reduction. So in order to place this implant in a spot where it has enough bone all the way around it to support it, it obviously can't be up here, right? Because half of that implant would be sticking out into space. So what we're going to do is we're going to shave the patient's jawbone down, so that way this implant can be placed and have a nice flat bed of bone that's wide enough to support it in all dimensions. So, trigger warning, some of the stuff gets a little gory here, so if you're not akin to looking at bloody stuff, feel free to obviously turn off your screen or turn away. But this is some of the more advanced procedures that we do in the dental field. For this particular patient, I made an incision on the top of the gums, and I pushed the gums on the back off and the gums on the front off, and I reflected that back so I can see that jawbone. And this is that sharp jawbone that we saw in that image previously. And so the plan was, we're going to shave all this down so we can get a nice flat bed of wide bone to put the implants in. So here I took a special instrument and I was able to shave all that bone down. And you can see it's very wide now. So if I want to drill a hole and put an implant in, that implant is going to be surrounded by good, healthy bone. So here you can see I drilled my holes, and everything we do in dentistry is really mini construction. So just like you're drilling a hole into some sheetrock or into one of your walls to hang to mount a TV or to hang a picture up, you're pre-drilling your hole for the screws that you're going to put in. That's exactly what we do in dentistry. And here you can see I've put in my implants, and this is a picture of me using a special tool to screw in that titanium implant. And for this patient, we're putting 3 in there. Now, one of the things I do that I didn't get into because we didn't have time, but I'll give you a brief introduction. I do a special process where I draw your blood and I spin it into a centrifuge, and it separates out your red blood cells from your plasma and your fibrin. And I'm able to take these plasma plugs that kind of look like this. They are very rich in platelets, and platelets are cells in your blood that help cause clotting. Right, so anytime you have an injury or a surgical wound, we want that bleeding to stop. So those platelets are there, and we've concentrated them to give you 20 times the natural amount of platelets in this little plasma plug, and we put that back into the surgical site. The other thing that platelets do is they release a lot of chemicals that kickstart the healing process, okay? And the healing process, if we've infused it with 20 times the amount of platelets, hence 20 times the amount of healing chemicals, we're giving it superpowers essentially in the world of healing by doing this particular process. I close everything up with some stitches. We're going to skip through this video here. But the patient comes back a little less than a month later. I take a panoramic x-ray, and you can see I have my 3 implants in the bone. You can kind of see where I've shaved and flattened the bone there, and I got 3 implants in there. And this is what we look like. So those plasma plugs that I put in there that I said really kickstart the healing process, we laid this huge flap. We decimated the bone. We tied these sutures, and in less than 4 weeks, it looks this beautiful and healthy. Okay, and a large part of that is because of those plasma plugs that I put back into the surgical site. I use a little mini metal detector to find exactly where my implants are underneath the gums. And I make small incisions, and I put in these little button attachments. I screw them into the implants. The implants are a screw, but they're hollow on the inside, so I can actually attach stuff to the inside of the implant. And I put these buttons on here that attach to the implant and stick up above the gums. I'm able to put the housing, what's called housing units, onto those buttons, and then I'll use acrylic that I mix with a powder and liquid. I put on the inside of the denture, then I put the denture over the top of these. That acrylic gets hard and captures these buttons into the inside of the denture. So if you can imagine, now every time the patient puts their denture in, it snaps in, just like your coat might snap when you're closing it up with your buttons, right? And as you all know, buttons give it retention. It keeps it closed. In this case, it keeps the dentures in place. It won't flop around. They can eat, they can bite with it, and it's not going to be giving them that discomfort of moving all the time like they previously were. So this is the denture in place. And this patient happens to have a lower denture and a top denture, and she's, happy and smiling with her denture. And I want you to listen for that pop. You hear that? So in order to get this denture out, because it has snap attachments, this patient actually has to use two hands and put a considerable amount of force, and then you hear them pop off. So that means they're staying in really well. So if they want to eat corn on the cob, if they're eating an apple, if they're eating raw vegetables, they can bite down on any side of that denture and it's not going to do what it was doing before, because now it has these button attachments. So we're going to play that for you one more time. And then I also want you to listen to the little pop that happens when she puts him back in. So here we're going to take him out. Takes two hands, a lot of force. You hear that pop. Then she puts him back in. And you can hear them kind of snap back in. But that's what we're looking for. Now, what we've done for this patient is we've increased their quality of life. They're not worried about their denture flopping out when they're talking in social scenarios. They're able to eat the foods that they previously weren't able to eat. That gives them the ability to go to restaurants with family and friends and not have to order mashed potatoes all the time. You see a health benefit that's immediate for this patient, but you also see a socioeconomic benefit for this patient because they're happy socially. They're more confident. They interact more. I've had patients tell me that after we did their teeth, they're more confident going on dates because now they're not worried about, talking on a date and their denture flopping out and being embarrassed. So it's 4:45. So I hope you enjoyed that case presentation, and I really kind of sold some of the advanced stuff that we can do in dentistry. I'm gonna open the chat here to see if there's any questions I could answer. Let's see. Let's see. How much do you usually charge? Was that from this session?
Yes, I
How much
believe.
do you usually charge to determine that? Ask because mom's currently looking for a place. So it depends. If you just need one implant, one implant start to finish minimally in this geographic area will usually cost you a little bit over $2,000. To do the multiple implants and the dentures we were talking about, generally you're probably looking at around the $5,000 to $6,000 mark. Some patients have insurance that help with that. Other patients, don't have insurance and have to rely on, either savings or drawing from a retirement account or something like that. It's not a very cheap thing to have done. But it's also a lot of expertise that it takes to do it. That's why clinicians charge a lot. There's a lot of liability that comes with it, a lot of technology you have to have at your disposal to be able to do it. So the cost of actually providing the care is really high. That's why you see the cost of getting the care being as high as it is. Can you ask questions other than dentistry? Sure. Don't mind at all. What struggles did I overcome when opening my first practice? I was lucky in that the practice I was working for was looking for a business partner, so I became partner. So I kind of walked into a system that was already flowing, but I was able to fine tune it to my particular business philosophy. One of the things that I did was, for instance, at the time we didn't take state insurance. A lot of doctors don't take state insurance because state insurance pays very, very low. And I'm not talking about, oh, it's not giving me my yacht money, right? I'm talking about it doesn't often cover the cost of providing the service. So it might, for taking a tooth out, and let's say that's an hour appointment, I'm paying my assistant 25 plus, there's maybe another $3 that goes towards their benefits over that hour. I'm using disposable equipment. There's the general overhead of the office. if it's one of my associate doctors doing it, they might make, $80, $85 an hour. So let's say that general overhead for that hour is $250, right? Or never mind, it's probably around $200. The state insurance pays $59. So you can see a lot of doctors don't accept state insurance because every time you're doing a procedure, you're losing money, right? Whereas a traditional insurance might pay, $280, $300. So there is a slight profit margin. But I was able to build a business model in which we're successful enough that we can see state insurance patients and not see them with the effort of trying to make money off of them. It's more of a way of giving back and being a resource to the community. And because a lot of offices don't take state insurance, I'm actually getting patients being referred to me for some of the surgeries that I do all the way. Like I'm in Covington and Bellevue. I got people driving all the way from DuPont and Olympia and Yelm and Ording because there's a shortage of providers that'll take state insurance. But I was able to build that business model to where I'm profitable enough to see this insurance, and that's my way of giving back and being a resource to the community. So you got two more messages. What should I know if I want to be an OBGYN? You probably shouldn't ask a dentist that. Ask a MD or OBGYN. So sorry, I can't. I didn't know that's what you meant by other than dentistry. Yes. So it looks like we're coming down on. Are we down to the 1 minute warning, 2 minute warning?
Yeah.
I do want to urge everybody, whatever it is you think you want to do, and you have plenty of time to decide, do your research, shadow professionals, talk to them, see the general ins and outs of what life is like once you've dedicated yourself to that career path. There's a lot of things that sound very romantic and great to think about being, but when you look at them, they may not fit what your other values are as far as what you want out of life. How much personal and free time and family time do you want? Do you want to be a business owner? Do you want to have autonomy? Do you want to be working for larger institutions? Like, you really want to start mapping that out to see which professions in healthcare fit your overall outlook down the road for your life. And then obviously as time goes, you can tweak it and change that as your wants and desires evolve. But do your research before you commit yourself to a big commitment like medicine or dentistry, something that's going to take a huge chunk out of your life and your resources. So yeah, if there's any other questions before we get that countdown, did I miss any questions?
Yeah, we were a little over the countdown. Sorry.
Oh, okay.
Yeah.
Yeah, well, I appreciate everybody. Thank you for giving me the opportunity to share my career and my life with you. It's always an honor to be asked to do this kind of stuff.